Today, we're digging into a medical mystery that's almost a century old. How could a simple, life-changing solution for sickle cell disease be overlooked for decades? This isn't just a story about a discovery, it's about finally ending a lost century of suffering. So listen to this. This is what a top executive at a major pharmaceutical company was saying just a few years ago, that sickle cell crises are basically random, unavoidable attacks. But what if they're not? What if the material we're looking at today shows they aren't nearly as unpredictable as the entire medical establishment has been led to believe? Okay, to really get what's at stake here, you have to understand the main enemy, the vaso-occlusive crisis, or VOC. This is when red blood cells warp into that sickle shape, get stuck, and create these tiny, excruciating logjams in blood vessels. The pain is off the charts, and over time, it just wrecks the body's organs. This is the central, terrifying event in a patient's life. All right, let's get into it, because this is where the story gets absolutely fascinating. The clues to stopping these crises, they weren't buried in some top-secret lab. Nope, they were published in scientific journals, hiding in plain sight for nearly 100 years. This timeline is basically a trail of breadcrumbs going back almost 100 years. Check it out. 1927, they find the trigger, low oxygen. Just 3 years later, in 1930, they find the antidote, just add oxygen back. Then, a huge clue in 1992. Giving oxygen in the hospital is too little too late. The damage is already irreversible. All the pieces of the puzzle were right there on the table, just waiting for someone to put them together. Let's just be crystal clear about this. The basic science was never a mystery. Low oxygen causes the problem. High oxygen, if you get it in there early enough, solves it. This fundamental truth wasn't some big secret. So, with this knowledge sitting there for decades, you'd think the solution would be simple, right? Well, instead, the pharmaceutical industry poured billions of dollars into chasing these super complex drugs that time and time again failed spectacularly. I mean, just look at this. In a huge trial in 2023 for a drug called Adaveo, patients taking the actual drug had more crises than the people taking a sugar pill, a placebo. It was such a mind-blowing failure that European regulators basically said, yeah, you should probably pull this. And it was the same story over at Pfizer. They make this massive $5.4 billion bet on a company. And what happens? Their main drug gets pulled because it was causing more crises and even deaths. Their next big hope failed too. Billions and billions of dollars down the drain, all chasing complex solutions. The source material we're looking at today keeps coming back to this one simple and frankly damning phrase. For 100 years, with all the data right in front of them, the entire medical and pharmaceutical establishment, they just couldn't connect the dots. But someone did connect them, and this is where the story pivots. It pivots to an independent researcher, Dr. Soda Omagui. He looked at the exact same century of data, the same clues everyone else had seen, and he saw the simple, elegant pattern that they had all missed. Dr. Omagui's breakthrough wasn't some newfangled molecule. It was a concept, the golden half hour. He realized that the initial sickling is totally reversible, but, and this is the key, only within a critical 30-minute window. The problem wasn't the oxygen itself. It was the timing and the location. By the time a patient actually gets to a hospital, that golden window has slammed shut. This one insight leads to a model that is just beautiful in its simplicity. Instead of waiting for an unstoppable crisis, you empower the patient. The moment they feel that first twinge of pain, right there, at home, they put on a simple oxygen mask. It reoxygenates their blood, the cells pop back to their normal shape, and the crisis is stopped before it can even really begin. The patient becomes their own first responder. Okay, so it's a brilliant idea in theory, but does it actually work? Well, let's take a look at the data from a study of 98 patients in Nigeria who actually put Dr. Omagui's model to the test. The results are, and I'm not exaggerating here, absolutely staggering. First up, a 79% reduction in hospitalizations. Just stop and think about what that means for someone's life. Going from a constant cycle of ER visits to actually having stability at home. And it doesn't stop there. An 80% drop in the need for blood transfusions. That's one of the most common and intense interventions they have for severe crises. Gone. But what about the pain itself? Well, the study found that pain scores just plummeted. On a 10-point scale, the average pain went from over a 5 down to just 1.5. In fact, 82% of patients said their pain was a 2 or less after using the oxygen at home. They were literally stopping the crisis in its tracks. Behind all these incredible numbers are real people. This quote from a parent, it just says it all. This isn't just about data points. It's about giving families their lives back. It proves this is a truly life-changing discovery. So, the really crucial thing to understand here is that Dr. Omugi's discovery isn't just a new treatment. It's a fundamental paradigm shift. It's a whole new way of thinking about sickle cell disease itself. Just look at the contrast on this slide. We are moving away from a reactive model, where you wait for disaster to strike and then try to clean up the mess in a hospital, to a proactive, preventative model. It shifts power from the hospital to the person, turning the patient from a helpless victim into an empowered hero who can treat themselves at home. And that brings us to our final thought. The science for this was out there for 100 years. The solution is simple, it's cheap, and as that study shows, it is unbelievably effective. It really makes you wonder how many other simple solutions are out there, hiding in plain sight, just waiting for someone to finally connect the dots.